This is a C. Jason podcast, and I am Catherine Moore, Nephrology Training Program Director at the University of Rochester, here to discuss our paper, Point of Care Ultrasound Training during Nephrology Fellowship. I am joined today by two co-authors of this manuscript, Charles O'Neill from Emory University and Daniel Ross from the Zucker School of Medicine. Point of Care ultrasonography, otherwise called POCUS, is a bedside diagnostic tool used to augment the physical examination and guide focused clinical decisions. Charlie, what prompted this study and what were our aims?
Well, POCUS has many important applications in nephrology, including diagnostic kidney ultrasound, assessment of hemodialysis access, kidney biopsy, and fluid volume assessment. Despite the clinical value, nephrology training programs have been slow to incorporate POCUS into their curricula, and the scope of training is unknown. We performed an educational needs assessment to determine the current status of POCUS training in U.S. Nephrology Fellowship programs.
We developed two complementary research surveys to assess the status of POCUS training from the perspective of nephrology trainees and program directors. Dan, what did we find?
631 fellows and 84 program directors and associate program directors participated in the survey. Only 38% of fellows reported receiving POCUS education during fellowship, and just 33% of those who did receive POCUS training reported feeling competent to use POCUS independently. Similarly, only 23% of surveyed faculty indicated that they had a POCUS curriculum in place, although 74% indicated a program was in development or there was an interest in creating a POCUS curriculum. Most fellow and faculty respondents rated commonly covered POCUS topics as important or very important, with greatest interest in diagnostic kidney ultrasound. Guided scanning with an instructor was the highest rated teaching strategy. The most frequently reported barrier to POCUS program development was the lack of available instructors.
This needs assessment demonstrates that despite high trainee and faculty interest in POCUS, the majority of current nephrology fellows are not receiving POCUS training, and perceived competence in POCUS is low among trainees. Although notably, the number of fellows and programs reporting POCUS training is increasing. Hands-on training guided by an instructor is highly valued, yet availability of adequately trained instructors remains a barrier to program development. To address this, we recommend investment in the POCUS education of faculty instructors within nephrology training programs. In addition, a priority of faculty development should include best approaches to the assessment of trainees' competence in POCUS.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.